As we continue our discussion on communications in physical therapy, now let's look at common terminology and abbreviations that are used in physical therapy. It is vital that you learn this language as treatment is described in these terms. The references for this language can be found in your appendices. First, we look at functional assessment and impairment terminology. These terms describe levels of functional ability. For example, the term independent is defined as the patient is able to consistently perform the skill safely with no one present. The term supervision is defined as the patient requires someone within arm's reach as a precaution, but there is a low probability of the patient having a problem requiring assistance. Close guarding refers to the person assisting the patient being positioned as if to assist, with hands raised but not touching the patient, with full attention on the patient, and there is a fair probability of the patient requiring assistance. Further definitions include contact guarding, and this is defined as the therapist is positioned as with close guarding, with hands on the patient but not giving any assistance, and there is a high probability of the patient requiring assistance. Minimum assistance is defined as the patient is able to complete a majority of the activity without assistance. Moderate assistance is defined as the patient is able to complete a part of the activity without assistance. And finally, maximum assist, which is defined as the patient is unable to assist in any part of the activity. You can see the gradation of assistance required from independent to maximum assist using this terminology. You should begin to memorize this terminology now as we use it throughout the program and throughout your career. Now let's look at some examples. In this first example, we see a woman early in the rehabilitation process following a stroke. You see that she requires the help of two therapists to attempt to walk. You see the therapists manually moving her legs forward to help her walk. She also requires the sturdy parallel bars to grasp as she attempts to walk. This level of assist would be described as moderate to maximum assist of two people. In the second example, you see the same woman farther along in the rehabilitation process. She can now move her legs on her own and requires the less sturdy device, a walker, to grasp for balance. Two individuals are still required for help, so this would be considered moderate assist of two. In the last example, you see the same woman still further along in the rehabilitation process. Now she is able to walk without an assistive device, with contact guard from one therapist and close guarding by the other therapist. These examples give you an understanding of functional terminology and its application to the progression of a patient. We also use common terminology for grading balance. When describing balance, we refer to static and dynamic balance. Static balance refers to stationary balance. In other words, how good is your balance when you are not moving? Dynamic then refers to your balance when moving, such as with walking. Now let's look at the grades. Normal is defined as the patient accepts maximal challenge and can shift weight in all directions in dynamic activities, and the patient is able to maintain steady balance without support in static positions. Good is defined as the patient accepts moderate challenge, is able to maintain balance while picking an object off the floor, for example, which is a less challenging dynamic activity, and the patient is able to maintain balance without support in static positions. And fair is defined as the patient is able to maintain balance with a handhold in static positions and accepts only minimal challenge in dynamic positions, such as being able to maintain balance while turning the head or trunk. Here we see the last two grades for balance, poor and no balance. Poor is defined as the patient requires handhold and assistance in static positions and is unable to accept challenge or move without loss of balance with dynamic activities. And no balance, of course, means exactly that. The patient is unable to balance themselves. Now let's look at a physical therapist performing a standing balance screen test.
Hi Ryan, I'm Wendy. I'm going to be your physical therapist today.
Hi.
Today what we're going to be doing is testing your standing balance. So before I have you stand up, I'm going to go ahead and put a gait belt on you so that I have something to hold on to in case you become a little unsteady. Now it needs to be firm but not prevent you from breathing. Does that feel okay?
Yeah.
Okay, good. Now what I'm going to do is first just have you stand up. Good. And I'm looking for your steadiness, and you seem fine. I would observe him for 60 seconds in this position. If you didn't have any difficulty, Ryan, what I'm going to now have you do is go ahead and close your eyes. And I would watch him with his eyes closed for 60 seconds, again looking for stepping responses, loss of balance, eyes opening. He's able to do that just fine. Ryan, I'm going to have you open your eyes. Now what I'd like you to do is bring your feet as close together as possible without touching. Perfect. And look straight ahead for me. And I would observe him in this position for 60 seconds. Doesn't seem to be having any problems. So now go ahead and close your eyes for me. And that again for 60 seconds. Go ahead and open your eyes. Now what I would like to have you do is put one foot in front of the other. I don't care which way. There you go. And have you keep your eyes open, looking straight ahead, looking for any kind of postural sway. And now I'm going to have you close your eyes for me. And you can notice that at this point he's having a little bit of increased postural sway and a little bit of compensation at the ankle. But he would still most likely be able to do this for 60 seconds. So Ryan, I'm going to have you open your eyes back up for me. Now, I'm going to start by having you stand on your unaffected leg, so your left leg. And I'm going to have you stand, but I'm going to have you go ahead and put your arms out for balance. Okay? So eyes open, looking straight ahead. And then go ahead and close your eyes. And typically you do single limb stance for 30 seconds rather than 60 seconds. But you can see that he is pretty stable. I'm going to have you go ahead and open your eyes, and you can put your foot down to rest. This time I'm going to have you stand on just your left leg with your arms crossed. Eyes open, and then go ahead and close your eyes. And again, you would test for 30 seconds. Go ahead and open your eyes. Do you have any pain standing on your right limb?
No.
Okay. So let's start with your arms out to your side, standing on your affected side. Okay, and let's have you close your eyes. Okay, open your eyes and relax. And now what I'd like you to do is go ahead and have your arms to your side and stand on your right side again for me, and then close your eyes. And again, I would do that for 30 seconds. Go ahead and relax. Now those are all tests for static standing balance. Now we're going to test your dynamic standing balance. So in this case, I would have Ryan stand up again. He's already in that position. The first thing I'm going to ask you to do is look over your right shoulder for me, please. Good, and come back. And there's no shift in weight or a compensatory step. Go ahead and look over your left shoulder for me, please. Great, and come on back. Now what I'd like you to do is grab this pen for me off the floor. Good. And there was no problems with balance doing that activity. So the next thing we're going to do is have you do the reaching like I did with you in sitting. So we're going to start with your left hand. So go ahead and reach for my hand. We're going to start with small reaches, a variety of heights, and work out further. And I'm wanting to get his center of mass away from his base of support and see how far I can take him. Good. Okay. I'm going to switch sides. We're going to do the same thing. Good. And come on back. And go ahead and sit down. Okay. And the last one is going to be the nudging. So I'll have you go ahead and stand back up for me. And this time I'm going to have you take just a small step forward so I can get behind you. Thank you. Now, what I'm going to be doing is giving you some nudges, just like I did with you in sitting. And I want you to try to stay upright. If you need to take a step, feel free. Okay? Okay, good. And go ahead and come back and have a seat. Thank you.
Now let's watch an example of a physical therapist performing balance training with a person suffering from Parkinson's disease.
Hi, welcome to Alpine Sports Medicine's Balance Training Program. My name is Karen Frosino. I'm a physical therapist, and I will be working with you if you decide to come to our clinic to improve your balance. This is Peter. He's a patient that we've been working with for a couple weeks, working to improve his balance. He has Parkinson's disease, and so far we've been able to increase his stability and decrease his potential for falling. So over here, I want to show you a couple of strategies that we've been working on with him. Here we're working on some stepping strategies to help him catch himself if he were to lose his balance, and this would help prevent a fall from happening. So I'm going to stand tall on Peter, and then just go ahead and step back 3 times with your right foot. Up, back up.
Reduce more of my little
One more time.
back and forth.
Okay. Okay. Okay, go ahead. Here we're working on some of the more of the sensory components of balance. We've changed the stability, decreased the stability under his feet, where he has to rely more on his vision and his vestibular system to help maintain his balance. This will help improve those components and make them more effective, thus preventing falls. So we're going to have him stand here with his feet unstable, and then have him do some exercises on here. So go ahead and stand nice and tall, Peter, and then have you just move those arms forward and back. Good. And then now go ahead and come up and come back down. Okay, very nice. Some of the other things that we also address are a patient's range of motion, strength, their posture, their coordination. Here we're working on improving the strength in his back, which will help hold him a little bit more upright, increasing his stability as well. Okay. Here we're working on just the stability and gait itself, working on improving his stride length and his step length, making him more comfortable taking larger strides. Here we are working on Peter's ability to stand with an emphasis on using larger, bigger motions, which has been very beneficial for patients with Parkinson's and Peter. And that's about it for Alpine Sports Medicine Balance Program. Thank you for tuning in.
Now that we've covered functional terminology and balance terminology, let's now move to abbreviations. You have been asked to memorize abbreviations as found in your appendix. Here are some examples in red font. If you see at the top here DX, that means diagnosis. L means left. FX means fracture, so this would be a diagnosis of left hip fracture. Here we see capitalized PT, this means physical therapist. So here we have the physical therapist diagnosis, which is impaired joint mobility, muscle performance, and range of motion associated with fracture. Here we see a SOAP note. In the S portion, or the subjective portion, we see PT but with a small t. This refers to the patient. This arrow refers to and from. Min refers to minimum assist, and NOC refers to night. So this would read, the patient states she transferred to and from the chair from the bed with minimum assist from her daughter last night. In the objective portion, this would read, after 3 trials, the patient stood and pivoted, NWB means non-weight bearing, on the left, to and from the chair to the mat, to and from the wheelchair to the toilet, and to and from the bed to the wheelchair, with SBA means standby assist, for LOB means loss of balance, recovery if needed. No loss of balance occurred. In the assessment portion, we see that the patient is ready for pivot transfer with a standby assist from nursing. And in the plan, we see that we will notify the physical therapist and nursing, and we'll evaluate the next treatment session for a possible skilled nursing facility referral. So again, it's important that you learn all these abbreviations so you can communicate effectively in the clinical setting. In summary then of communications part 1, 2, and 3, we looked at forms of communication, cultural competence, and terminology and abbreviations commonly used in physical therapy.